Oh, welcome back after our break. And we're still on H259, and we've invited in Captain Roger Farmer. If you'd like to come on up. Right up at the front. Just wanted to there's some very small pieces in this bill that have to, have a seat if you wish.
Certainly.
Are these?
If I can squeeze in.
Is she allowed to say Eddie's? We don't get a lot of DPS in this committee very often, so. Yeah, there's just some small pieces in the bill that.
No, it did not.
Sorry, everyone. Okay,
Nice.
Kristen, good say it. Welcome. Just wanted to have you speak on the pieces around coordination between hospitals in their security plans and working with local law enforcement or law enforcement in general.
Basically, we got the request yesterday, so I'm a little late coming to the table. And I did have a chance to review the bill, obviously, and I did have a chance to speak with a couple of my counterparts within DPS and Vermont State Police. And it's certainly our stance that we're supportive of the bill. We already have strong working relationships with the healthcare industry. Obviously, there's a lot of overlap there with the folks that we deal with. And unfortunately, at times, we are the people bringing the problem individuals into the healthcare system. So there's a tight working relationship there already that exists. And so I think some of the points that were brought up in the bill were referring to, law enforcement involvement in working through coming up with these policies and procedures and safety protocols. And that's obviously a very natural fit for us. And I think it's appropriate for us to have a seat at the table in these discussions. So, and again, I'm speaking from just the perspective of the Vermont State Police, and in reality, and this is just an anecdotal thing, but probably 90% of the hospitals are covered by local PDs. And that's just something to keep in mind. I'm speaking from the Vermont State Police perspective, but primary law enforcement or services are largely provided by local PDs for a lot of the hospitals throughout the state. So something to keep in mind.
Any questions? Yes, Alan.
When you bring somebody into the ER and you have a sense whether they're going to be violent or are violent, you hang around a while?
So it's kind of a case by case situation that you have to assess the individual, the level of comfort from the hospital, what resources they have available. Some hospitals have more of a secure holding situation than others do. And you bring up a good point. There are times that law enforcement is required to stand by with that individual. And that is, we're dealing with staffing crisis as is every profession, but that becomes a little bit of a heavy lift for law enforcement to have to sit with someone for extended periods of time. And sometimes, a good example is like the emergency evaluation, that they're a danger to themselves or others. But there have been instances where, we're going to have to be there overnight, or another law enforcement entity is going to have to be there for an extended period of time. And that's just it's a lift at times.
I got one more too.
Yeah.
Okay, is there any time that you do not bring them to the ER, or is there other resources available?
There are, and I think we're trying to move away from, and again, this is getting a little bit out of my lane and more into the mental health situations. But if we're able to get services provided, if we can bring them back to the barracks and have some services provided there and avoid going to the emergency room. So there are some alternatives, but unfortunately, a lot of times the fallback is the hospital.
Good, thanks.
Woody, did you have a question? Oh, I'm sorry. I thought I had seen your hand.
Yeah, that's the question that I was thinking.
Brian, did you have a question?
Yeah. Does this state police still have to transport people when they're involuntary to Brattleboro or the state hospital? Is that still something that you have to do a lot?
A lot of the time, so we have, obviously the state police, we have the embedded mental health care workers. So sometimes, depending on the individual, we can utilize them to sort of a lower level of security, but we still will do transports if and when we're required to.
It sounds like you try to do it in the least restrictive way.
If we can, yeah.
What barracks do you work out of?
So I'm the troop commander for the southern half of the state. So I kind of float around for the 5 different stations down in B Troop, which is the southern half of the state.
And then the only other question is, from the perspective of the state police, have you witnessed an increase in violence towards healthcare workers?
So I was hoping to come with some numbers on that today. So we use Valcor, which is our CAD RMS system. So that's how we track data. So I was hoping to come in with some numbers. Unfortunately, it doesn't break down. So I think it's 13 VSA 1028 that covers assaults on firefighters, EMS, healthcare professionals, and law enforcement. So while I can get overall numbers, it doesn't break it down by which profession that the assault occurred on. And I would guess most of those were probably law enforcement. So anecdotally, I don't know whether there's been an increase or not. It seems like the incidents of violence are increasing, but not just with health care, but just across the board society.
And would it be hard to mention anyway? Because I'm wondering, is that only what's reported that goes in there? Like if it's not reported to the police, then
Correct. If it just happened, if there was no law enforcement present, if it just happened within the hospital and didn't get reported out, then we're not capturing that data at all.
But based on what law enforcement is documenting or what is reported, it appears as if there's an increase in violence towards frontline workers like EMS, police, firefighters, and
Again, I just went back the last 2 years, and again, that was just an umbrella over all of those professions, and the numbers were fairly similar over the last couple of years. But again, that's just within VSP, so that's just our agency. So again, a lot of the hospitals are covered by local PDs, so those numbers may look very different.
thank you.
Sure.
Thank you. Any other questions? Well, thank you so much for coming in.
Absolutely.
Thank you.
Thank you for what you do.
Thank you.
Thank you for what you do. Thank you. All right, so Westminster. We're coming back.